fear which most of us have, which I had. Like, I would, because I dedicate this presentation, these thoughts, all which I have got to my teachers and to the next generation teachers as well, because this is how we transmit knowledge, and this is how the entire world ultimately gets benefited out of it. So the common concept, what discussion which we used to have as a child at my home is like, we used to discuss about somebody's blessed with a great hand. And I'm sure you must have encountered, आपका हाथ गुण बहुत अच्छा है साहब, उनका हाथ गुण अच्छा है. This is a common thing which is there. So from my younger days, this was really which fascinated me. Like, are somebody truly born with this? Are they truly gifted? And when you are doing residency, you will feel that some of your peers are doing better than you, and you get such an inferiority complex there itself. And you're convinced yourself that you are not good enough, and that's the end of your career. You'll be thinking whether I've chosen the right specialty as well. I would have got these doubts when I was doing my residency as well. So, is it a myth or a fact? When you Google out and you found out that, I found that this picture is from Google. It shows that, I presume this is the God which is directing the, eye surgeon there. So it just justifies that ophthalmic surgery is really very, something to be proud of, where we require divine intervention to get it right. So this is what it is. Now, it is really mystical and fascinating, and especially for the budding young surgeons, you are told that either you have it or you don't have it. Hath kaisa hai iska? That's all they ask, that's what it is. That, and it's such a demotivating thing for the younger surgeons, and you're convinced that you're not made for it, cut it for it, okay? So let me just take you through it, I believe that surgery is done with the mind and not the heart, okay? So you're getting, the hand is getting undue recognition. So actually the great surgeon has trained his mind to such an extent that he or she can anticipate, plan, analyze, and then implement this. And that's the reason why the results are better in particular group of surgeons compared to other. So it is not just the hand, okay? So I believe that if there's one message which I want all of you to take is, it is done with the mind and not with the hand. Dexterity of the hand is critical, okay? It's important, especially as an eye surgeon, but it is not the most critical thing. It's not the most critical thing. What you have to have is intelligence, knowledge, and creativity. And of course, as surgeons, any surgeon, courage forms an important part. And because we are going to fall, we are going to fail, and however, what is the ability for us to get up again, that's what defines us. So these are more important attributes to have rather than, just best with the thing. And second thing, another important thing, if you have got the best rank in your multiple choice question exams and you got the best college, and somebody doesn't have a good grade and he has gotten a very mediocre college, that also does not differentiate from you becoming a good surgeon or a bad surgeon, believe me. So you can have a surgeon who has qualified from the top college, he might not be good enough, but a surgeon who is from mediocre college, he can still be good. So there are not, a single aspect doesn't differentiate you from being a good or a bad surgeon. Again, a point to note. So good surgical judgment is probably the most critical thing which differentiates an excellent surgeon from an average surgeon. I'm just going to, and this is something which can be got by experience. But the whole exercise of my presentation is you don't have to spend 20 years to get this judgment. As mentors, we can train our young surgeons to develop this judgment at an early thing. So how do you train this? Again, you have to train the mind. That's the one thing. So I believe the surgeons are made, okay? Surgeons are born great. I think it's a myth, but let me counteract like this. I am involved in training quite a lot of young surgeons and interact with a lot of them, and after having a reasonable experience of in this field, I would like to say that if you classify, you take 100 surgeons, 3% of them are extraordinary. They're blessed. There's no doubt about it. Okay, the God has been very kind to them. They are extremely intelligent, and they've got extremely good eyesight, which is very critical for eye surgery. Maybe the depth perception is superb, and they've got superb stabilized hands. That also is there. This 3% are blessed. Maybe like Sachin Tendulkar. No, you can never have a Sachin Tendulkar who can play for a country at 16 years. He was truly blessed. And on the contrary, there is also a 3% of them who are poor, who can't learn surgery. That also is a fact. I have come across this group as well. The reason is they are not interested to improve upon. And majority of us which fall in this 94%, that is the average category, and this is where I'm really interested in. And if we can put in effort, we can squeeze majority of them into the top 10% group, and that is what is required. The candidate should have the right attitude, and they should get the right guidance from their mentors. And this is a typical learning curve which we discuss about all the time when you're learning surgery. To begin with, you're clueless of what you're doing and you're naively confident. I think you'll learn the surgery until you have a major fall like this, and this becomes discouraging and it is realistic. This is where you feel realism, and now you're really doubting yourself whether I'm fit enough to become a surgeon. So let us watch. This is a typical learning curve which we see, Over a period of time, you become from a novice to an expert surgeon over a period of time. But what improves over a period of time is ultimately the quality of decisions which you take. From poor, it becomes optimal or good. That is what experience does to you. So this is the journey to the mastery, and this is the typical levels of learning, what you can say. So actually you're unconscious about your incompetence, first of all, when you begin with. When you become conscious about your incompetence, then actually the learning happens here. And this is a very common question asked to me, okay? How long does it take for me to become an expert? Okay, in terms of time, in terms of cases. So, well, the answer is simple, okay? You just look in the mirror, you get the answer. You can't blame the system, you can't blame the mentor, you can't blame anybody. Look in the mirror, the answer lies there. Some surgeons can pick up surgery in 100 cases, 500 cases. Some cannot, even after doing 5,000 cases. And it takes, somebody might pick up in 1 year, somebody can pick up in 10 years. So it depends upon the self itself. That's it. You can't blame anybody else. So, but the matter of the fact is, eventually you can upgrade. The only issue is how much time. So it is differentiated. Everybody cannot master that particular step or that particular surgery in 100 cases. Somebody can take 200, somebody can take 500, somebody can just take 50. So I've encountered all these categories. So can we accelerate the learning curve? That is what a goal of a mentor should be. So I have divided this into three steps, okay? The learning the motor skills, dexterity, that's what we improve dexterity. Second would be there are certain secrets which have to be shared by the mentors. There's no other way, because the person has to learn, it will take a long time. Second would be the decision-making aspect. This again has to be taught by the mentor so that you're preparing the candidate well enough for doing this. So let's just watch this video. This is one of the young surgeon who's doing maybe the first, second or third case, and just look at the hand movements which you're seeing. Okay, so this is something which is a motor skill. Look at this case again, Look at the way the hands are trembling and shaking. This is a motor problem. This is something to improve upon. And there are multiple ways to do it. And I have had people who have access to the machine learning. What is it called, Venkatesh? The thing? Simulator. But I feel, now how do you improve your motor skills? I still feel that, that may not be the best way to do it. And I feel suturing, learning suturing, I think a 10-0 nylon suturing, that would probably be the best way to improve your surgical skills. Of late, majority of us have stopped suturing now. And that is the reason why you're just trying to do phaco and rexes, that's all it is, like playing a video game. I want you all to go back to suturing, 10-0 nylon suturing, and just chart your progress through it. How much time are you taking to complete 10 sutures? How much of them are of good quality? And this is, you grade according to yourself. That is how you are going to chart your progress. So that is one of the important tips I'd like to say. If you want to improve dexterity, I think start suturing. And maybe 1 hour suturing per day, if you're your target, you will definitely improve over a period of weeks or months. And next would be decision making, which has to be taught. Unfortunately, common sense is not so common. That's the reason why this is important. Now, this is a surgeon who has done about 1,000 surgeries. And look at the thing now. This is a fairly complicated cases. Even for an experienced surgeon, you would think twice what it is happening. Now look, it's a brown cataract. Rexis is done, rexis is not done, and the nucleus is moving along with the bag. Can you see this? And the surgeon is so confident about himself. He's trying to do the job here by sculpting here. Okay, just look at it here now. the nucleus is too hard and he's not using the right power, and he has certain belief in himself that he can crack this. And this unwavering belief among himself, that's what he's doing, and he doesn't stop until watches what happens now. So sometimes this overconfidence is such a thing, like, just goes down. And now he's successful, okay? Now he's very successful in pushing it down. So what is the problem here? The problem is self-assessment is wrong. Your own self-assessment is wrong. You believe that you're skilled enough to do that, and this is a case which definitely not, doesn't fall into the category. So your awareness itself is an issue here. So 1 more minute for me? Yeah, sure. So practice, how to improve your hands, practice with suturing. Second would be observe your mentors, how they're operating. What is the way they're trying to get the support of the hand and the wrist. I think the best way would be to find a way to support your hands. If your hands are shaky, try to support it using patient's cheek or forehead or something. Actually, our mentors used to tell us that, it's your hand, bloody, you should support it. Why are you recording anything else support? That also you have. But if you're finding it really difficult, try to find some support there. So decision making in crisis, every complication, you should have a game plan to begin with. Okay, we don't want an Abhimanyu-like syndrome. So you should have in every possible situation, like nucleus drop, endophthalmitis, you should have a descendant membrane death, everything you're going to encounter in your career. If you're not so lucky to have encountered until now, you are going to encounter. Have a game plan, not about just how you're going to manage. So I would recommend to divide this complication management into two aspects. Intraoperative strategies, which is clinical based. Second would dealing with the patient. Because whenever this happens, you're more worried about what am I going to tell the patient rather than actually dealing with the things here to do the right thing. And that is going to mess up your thing. So, you have to by heart these strategies. Okay, nucleus is dropped, no problem. I'm not the first person in the world to drop it. So these are the things which I know to by heart. I don't want to fish for the nucleus. I want to minimize maneuvers. I want to protect the endothelium so that my VR surgeon can pick it up easily. I don't want to mess it up firmly. And then you close it. And then next would be what I'm going to tell the patient. What phrases am I going to actually use to the patient? This is what you need to learn and by heart. So the cataract could not be removed, unfortunately. It was not accessible. It is behind and it cannot be done in my setting. Don't worry. I'm going to arrange for the management of it. This reassurance is going to help you a lot. So this is what I want all the mentors to train our younger colleagues for this. Prepare them for the battle. Most of the when they come out, they're so that they're not at all battle ready, neither technically nor in the mind. So that's the reason why it is an urge for both mentors as well as the. So I think my time is up here. So I'd like to conclude by. So nowadays, you can be your best teacher here. The only thing I would like to see is record each one of your surgeries and analyze honestly, and develop a true sense of self-awareness and be a self-critic. That is what you are going to be. It's going to benefit you in the long run. So believe me, you can be your best teacher, but be honest with yourself. Thank you so much for your patient hearing, and thank you, Venkatesh, for the opportunity.
Deepak, we're going to get back with a few slides now once we have time at the end. So I want you to be here. Okay, you can go and come back. If you finish there, you can come back. But anyway, if you have any quick questions, we can ask Deepak because he wants to leave, but we'll try to get him back. But it's so important what the message is giving. Even if you have all the new innovative things, I think the old school in this thought is very, very important. Where you have to be calm and composed in whatever we do, in the training and also when we have a problem during the training.